Hello guys, today we are going to discuss about a blood test called CD4 and CD8. This test is generally used to identify the nature and strength of the immunity, especially the persons who are having less immunity or for example HIV infection patients. Use of the test. This test is done to measure the strength of your immune system if patients have been diagnosed with HIV infection. Occasionally, it may be used with other conditions. If patients have been diagnosed with HIV, soon after patient is first diagnosed to get a baseline assessment of immune system. 2 to 8 weeks after starting anti-HIV therapy and then every 3 to 4 months if continued therapy. CD4 and CD8 cells are lymphocytes that have markers on the surface of the cells called CD4 and CD8. They are types of your white blood cells that fight infection and they play an important role in your immune system function. CD4 and CD8 cells are made in bone marrow and mature in thymus gland, a small gland found in the upper chest. They circulate throughout the body in the bloodstream, spleen, and lymph nodes. CD4 cells are sometimes called T helper cells. They help to identify and trigger the attack and destruction of specific bacteria, fungi, viruses that affect body. CD4 cells are a major target for HIV, which bind to the surface of CD4 cells, enter them, and either replicates immediately, killing the cell in the process, or remains in a resting state, replicating later. As HIV virus gets into the cell and replicates, the number of CD4 cells in the blood gradually declines. The CD4 count decreases with HIV disease progression. This process may continue for several years before the number of CD4 cells drop to a low level that symptoms associated with AIDS begin to appear. As treatment reduces the amount of HIV present in the body and slow progression, the CD4 count will increase and stabilizes. CD4 cells include lymphocytes that are called cytotoxic T cells and T suppressor cells. CD8 cytotoxic cells identify and kill cells that have been infected with the viruses or that have been affected by cancer. They play an important role in the immune response to HIV by killing cells affected with the virus and by producing substances that block HIV replication. These tests measure the number of CD4 and CD8 cells in the blood and in conjunction with HIV viral load test. Assess the status of immune system if you have been diagnosed with HIV. As the disease progresses, the number of CD4 cells will decrease in relation to the number of total lymphocytes and CD8 cells. To provide a clearer picture of the condition of the immune system, the results of this test may be expressed as a ratio of CD4 to total lymphocytes or as a ratio of CD4 cells to CD8 cells. The tests are most often used to help monitor disease progression in HIV, but may also be used occasionally in other conditions such as lymphomas and patients receiving immunosuppressive medication or in the diagnosis and monitoring of primary and non-HIV related immune deficiencies. Sample required. Blood. Normal range. A normal CD4 CD8 ratio is greater than 1.0, with CD4 lymphocytes ranging from 500 to 1200 cells per cubic millimeter, and CD8 lymphocyte ranging from 150 to 1000. If your ratio is higher than 1, it means your immune system is strong and you may not have HIV. If your ratio is less than 1, you may have immune deficiency. That is about CD4 and CD8 testing.